Disease called African swine fever has been spreading out in China, Vietnam, Mongolia, Cambodia, and even in North Korea, leaving South Koreans worried that it might spread in Korea too. Since there are no current available medicines or vaccines to cure this disease, the best we could do is to prevent it from spreading. With this, from June 1, the Animal and Plant Quarantine Agency has reinforced that those who fail to declare hand-carry animal products will have to pay fines up to 10 million won. Individuals coming from countries suffering from African swine flu who fail to declare hand-carry products such as pork will have to pay fines depending on the number of violations. Foreigners who refuse to pay the fine will not be allowed to enter the country or will be restricted to stay in Korea. Also, remember that meat products like ham, sausage, beef jerky, and so on are restricted items when entering Korea. In case you are carrying such products, don't forget to declare those using the customs declaration form and submit it to the quarantine officers at the airport or ports. Lastly, those who work at agriculture and livestock industries are requested to refrain from visiting farm or livestock market within 5 days after traveling overseas. You are a quarantine officer who makes Korea clean.
It has been 2 months since the mandatory health insurance subscription system for foreigners took effect. Foreigners who stay in Korea for 6 months or longer are required to enroll to the national health insurance system. Even though many foreigners have signed up for health insurance, it is a fact that subscription for employee coverage insurance is still difficult. Last May, Mr. Won, a Vietnamese worker in Yangpyeong Gyeonggi Province, received a letter from the National Health Insurance Corporation's Yangpyeong branch telling him that he is listed for enrollment in the health insurance program. The letter stated that if he stays in Korea, he will be automatically enrolled into the National Health Insurance Program. Since then, after the implementation of the system, Mr. Won has asked his employer to subscribe him to the employee coverage health insurance in accordance with the instructions, but his employer did not proceed to do so by saying that he is unaware of the situation. According to the consultation team of the Korea Support Center for Foreign Workers, the number of such counseling cases being filed is on the increase. The only response received after contacting the National Health Insurance Corporation was to report the case to the Ministry of Labor. The National Health Insurance Corporation also stated that self-employed coverage insurance subscription is a problem that should be handled by the employer. In other words, foreign workers should sign up for self-employed coverage insurance rather than the employee coverage insurance. If a foreigner signs up for a self-employed coverage health insurance plan, the monthly premium is 110,000 won. Due to this, most foreigners hesitate to subscribe to an insurance plan that is double the amount of the employee coverage health insurance premium. Foreigners who fail to pay insurance fees after enrollment will be limited from gaining benefits of the health insurance program. They may also suffer disadvantages in immigration matters under the Ministry of Justice, such as restrictions on their period of stay during visa extension application.
법무부는 건강보험료를 수월하게 거둘 수 있도록 이주민들의 체류 자격을 담보로 잡겠다고 한다. 건강보험료 미납자는 3회까지는 단기간 6개월 이내 체류만 허용해주고 4회 체납 시는 아이의 체류를 불허하겠다는 것이다.
The mandatory subscription of health insurance to foreigners has become a problem, producing a great deal of anxiety and strain to foreign workers.
At MNTV, we'll see video clips about accident and incident, as well as news report related to immigrants. If you'd like to report, please call us or contact us via email.